see you, Sue. Thanks for coming in today to chat with us.
Okay, I'm happy to.
Thanks. Now, your surgery was about 3.5 months ago, I think?
Approximately, yeah.
Yeah, approximately.
Yeah.
How have things been going for you since then?
Well, I haven't noticed any problems. It's been just fine.
Okay, great. All right. I kind of wanted to know what prompted you to make the decision to enter into the study.
Okay. Well, it's a downhill channel when you have this sort of thing, and it's a chronic condition. And so I thought it might be an opportunity to have a chance at something slightly different. That's all.
Fair enough.
Yeah.
How'd your family kind of discuss with you about the ideas?
Well, they were very encouraging, actually.
Yeah? Okay. And still feel encouraging at this point?
Yeah, absolutely.
Great. So I know that we've interacted a lot doing some of our, testing. Yes, exactly. Yes, you can't forget that from me, right? How have you found all of those experiences with us?
Oh, quite fine. The testing is very interesting to participate in, and but it's been quite easy and it's been made quite pleasant.
Oh, that's good to know. Thank you. Yeah, I know sometimes it can be a little bit challenging, so it's good that you feel
for sure.
feel that it hasn't really worn you down too much.
No, not at all.
Great. And how about the surgery itself? Did you feel prepared for what you were going to be experiencing?
Yes, I think I did. It was very straightforward, and it was pretty easy, actually. I was surprised how easily it went, and the recovery was pretty straightforward as well.
Okay.
I didn't have any problems or anything like that.
Oh, great.
Yeah.
How about, I know that during part of the surgery, you're awake for part of that. Was that something you found difficult, or?
No, actually, it was just more interesting.
Oh, okay, good.
I was kind of watching what people were up to and
okay.
listening to the conversation.
Was it different than on TV?
Not really.
Not really. Okay, good enough.
No, it was just people at work.
Yep, absolutely. Very good. So it sounds kind of what you expected. Yeah.
I think so, yeah.
Okay. And any kind of pain or discomfort afterwards?
No, not that I recall particularly.
Okay, great. What do you think was your biggest kind of concern going into it, if you don't mind sharing that?
Okay. Well, it's just mostly the unknown, really. Is what's it going to be like, or how is it going to really make an improvement or change for me? That sort of thing, I think, was kind of mostly what was on my mind, I believe. Yeah.
Did you have a chance to kind of talk with anybody else, or who might have had a similar kind of experience? Or
I don't particularly recall having talked with anyone of that experience, but I mean, I wasn't really worried about the surgery part of it, like the actual physical surgery part of it, because that was fairly straightforward from what I could understand, and it was really. It was just really what is going to be the outcome, and how's this going to work for me?
Right, fair enough. Yeah, very natural, no questions for everybody entering into that.
So, yeah.
Okay. So obviously we've had more challenges probably this year than most years because of the whole COVID situation, right? I'm sure that added an extra kind of bit of uncertainty for all of us. Did you feel like you felt comfortable coming into the hospital during this time?
Actually, yes, I did. I wasn't worried so much about the COVID end of things. I mean, everybody was masked, and people were washing their hands and things like that, and that's pretty much all you can do, really. So
okay, so you felt kind of comfortable enough with the procedures.
Yeah, I did. Oh yeah.
Okay, that's good to know, because it can certainly make people more fearful about the idea, but it's good to know that wasn't something that was really bothersome or prohibiting to you.
No, I think that everything went as needed to.
Great. Okay. And coming back for the follow-up visits has been fairly straightforward for you as well?
Yeah, they have been pretty straightforward. They've been good.
Okay. Despite the fact you've been through more scanning than the average grocery item these days, you've done well with it, right?
Yes, I have.
Okay, good to know. And I guess one thing just to ask, now that you've kind of been at least partway through, 3 months through, but all of the work that took place beforehand, what kind of, you said you hadn't had really a chance to talk to somebody who'd been through it before, so now you have a chance to give some information to people who might be considering it. So what kind of, guidance or information or would you suggest to somebody who might be contemplating doing this?
Well, I think I was focused a little bit on just the actual physical act of the surgery and that sort of thing, and I wasn't sure how it would look afterwards, or how long it would take, or I wasn't so sure about. So maybe that's one of the things that they might want to know what the best guess is, I guess, so in terms of what they can expect afterwards in terms of timing of things.
Right. You mean like timing of recovery when you're feeling well enough to kind of be up and about?
That's right. Yeah.
Okay.
Yeah. That sort of thing.
Okay. All right. Any other kinds of things that you think would have been helpful or might be helpful to other people considering doing this?
No, I can't think of really anything else.
Okay.
Because you covered things in the pre-op stuff, and I was given enough information, I think.
Okay.
I pretty much understood what was going to happen. And
good. And do you mean both written information as well as the opportunity to talk to people and get all your questions answered?
Yeah.
Right? Okay. Okay. Excellent. Well, that's kind of all the questions that I wanted to address with you today.
Okay. All right.
Anything else that you'd like to kind of share with me about your experience or?
Well, actually, kind of from my perspective, it seemed to go fairly easily. It was daunting at first, in terms of my thoughts about it. I'm worried about it, but it's actually turned out reasonably good, and not really haven't had any problems or anything like that. So it's been, I think, a pretty good experience overall. And certainly the day of surgery and those kinds of things are pretty nicely handled. So.
Good. Well, as I say, I think that's really your ability to kind of share your own experience is helpful, I think, for other people who have the same kinds of concerns and the unknown coming into
unknown.
Absolutely.
But now it seems to all clear.
Okay, well, fair enough. I'm very appreciative that you're able to share those observations with us. Thank you.
Okay.